Have you ever felt your heart suddenly racing while you read just sitting quietly in your favorite chair? Or maybe you stood up too quickly and the room seemed to spin a little too long. These moments might feel small, but sometimes they're gentle whispers from your heart, asking for help. Heart failure doesn't always arrive with a dramatic heart attack or a rush to the hospital. Most often, it begins quietly, with tiny signs that are easy to miss. And that's exactly what we're going to talk about today. Those early, silent clues your body gives before things become serious. No medical jargon, no scary statistics, just an honest conversation about what your heart may be trying to tell you. Because ignoring the little signals could one day lead to big consequences. So, if you're ready to really listen to your heart, type 1 in the comments. If not, just type 0. And don't forget to subscribe to Health 365 for more simple, life-changing health tips. Now, let's dive into the very first warning sign, one that often slips under the radar. 1. A racing heart at rest. When your heart is tired, it doesn't always cry out with chest pain. Sometimes, it speeds up, like a worker rushing to make up for lost time. Normally, your heart should beat calmly, around 60 to 100 times per minute when you're resting. But if your heart is weak, it has to work harder, even when you're sitting still. That's when you might feel your chest pounding, fluttering, or racing for no reason. Some people describe it as a sudden thump-thump that catches them off guard. This isn't just a passing sensation. Over time, it can wear your heart out. The American Heart Association warns that a consistently high resting heart rate is linked to earlier heart failure and higher risks. If this happens to you, don't ignore it. Keep a simple log of your resting heart rate. If it's often above 100, talk to your doctor. A small step, but it could save your heart. 2. Brain fog and memory lapses. Do you ever walk into a room and forget why you were there? Or lose focus in the middle of a conversation? Many think this is just aging, but it can actually be your heart. When the heart struggles to pump blood, less oxygen reaches the brain. That can leave you feeling foggy, forgetful, or distracted. Studies show even early heart failure is linked with cognitive decline. So, if you notice these lapses, especially after activity, track them. Patterns help doctors see the connection. It's not about panic. It's about protecting both your memory and your heart. 3. Swelling in the legs and ankles by evening. Do your socks leave deep marks on your ankles? Do your shoes feel tighter than they did in the morning? That's swelling in just tired feet. It's fluid building up because your heart isn't pumping effectively. Doctors call this peripheral edema. A simple home test. Press your thumb into your shin. If a dent remains, that's a red flag. And if swelling comes with sudden weight gain or shortness of breath, call your doctor. Your legs are often the first to reveal what's happening in your chest. 4. Dizziness and near fainting. Do you feel the world tilt when you stand up? Or get lightheaded during simple activities? This can mean your heart isn't pushing enough blood to the brain. And for older adults, it's not only uncomfortable, it raises the risk of dangerous falls. If dizziness happens more than once, take note of when and why, and bring that info to your doctor. Your balance and safety depend on it. 5. Frequent nighttime urination. You wake up multiple times a night to use the bathroom. This might not just be age or a small bladder. When you lie down, fluid shifts back into your bloodstream, making the kidneys work overtime. Doctors call this nocturia, and it's often an early clue of heart stress. Broken sleep isn't just annoying, it drains your energy and strains your heart further. If this sounds familiar, track how many times you wake up at night. Your doctor needs to know. 6. Cold hands and feet. Ever notice your hands and feet stay icy cold even when the room is warm? When your heart is weak, it sends blood to vital organs first, and your hands and feet get less. It may feel minor, but it's your body showing you where the blood isn't reaching. If your fingers and toes are cold compared to others, that's a clue worth mentioning. 7. shortness of breath with light activity, climbing a few stairs, carrying groceries, even walking to the mailbox. If these simple tasks leave you breathless, it may be more than getting older. When the heart can't pump strongly, fluid backs up into the lungs, making breathing harder. This is one of the most common early signs of heart failure, and it is often dismissed. If this happens to you, take notice. Keep a small log of when it occurs and how you feel afterward. It could make a huge difference in catching heart trouble early. 8. Needing extra pillows to sleep. Do you struggle to breathe when lying flat? Do you find yourself propping up with 2 or 3 pillows? Or even sleeping upright? This is called orthopnea, and it's a classic warning sign. Fluid shifts upward when you lie down, putting pressure on your lungs. If you can't breathe comfortably without extra pillows, your heart may be telling you it needs help. 9. Sudden weight gain. Have you gained 2 to 3 pounds overnight or 5 pounds in a week without changing your diet? That's not fat, it's fluid retention. And it's one of the simplest, clearest signs of early heart failure. That's why many doctors recommend weighing yourself daily. A sudden jump in weight is worth a phone call to your healthcare provider. 10. Stomach fullness or loss of appetite. Do you feel bloated after just a few bites? When fluid builds in the abdomen ascites, it presses on your stomach and liver. This can steal your appetite and your strength. If meals feel heavy or unappealing, don't brush it off. It could be your heart, not your stomach. 11. Nighttime cough or wheezing and nagging. Dry cough at night that doesn't improve with allergy or cold medicine can actually come from your heart. When fluid seeps into the lungs, it irritates the airways, leaving you coughing or wheezing, especially when lying down. If this sounds like you, track when it happens and how sleeping upright affects it. These details matter for your doctor. 12. Breathlessness when bending forward. Ever get short of breath just tying your shoes? This surprising symptom, called bendopnea, happens when bending shifts blood toward your chest, straining a weak heart. It may feel small, but it's one of the body's clearest warning signals. 13. Constant fatigue. And finally, one of the most exhausting signs, fatigue that lingers no matter how much you rest. If folding laundry, carrying groceries, or even taking a shower leaves you drained, it's more than just aging. It's your body telling you the heart isn't delivering enough oxygen to keep up. Unlike normal tiredness, this exhaustion doesn't fade. It lingers and slowly robs independence. Track your energy levels, and don't dismiss them. Your body is speaking, and your heart needs attention. Final thoughts. So, now you've seen how heart failure often begins, with small, quiet signs, a racing pulse, swollen ankles, restless nights, or unusual fatigue. These signals may seem harmless, but they're your heart's way of asking for care. The good news, catching them early can change everything. With the right care, lifestyle changes, and medical support, many people live long, full, independent lives. Your heart has carried you through every moment of life. Now it deserves your attention in return. If this message spoke to you, share it with someone you care about. And don't forget to subscribe to Health 365, where we bring you clear, caring guidance for a healthier tomorrow.